Hello, my name is Dr. Fruitman. I'm a board-certified psychiatrist. I'm medical director of Trifecta Health. My patients who frequently come here for treatment of adult attention deficit disorder ask me exactly how addictive are stimulants. For example, exactly how addictive is medication Adderall. Adderall is a Schedule II narcotic as designated by Food and Drug Administration. Schedule II narcotic means it's a highly controlled medication that Food and Drug Administration considers to have very high addiction liability. Just wanted to compare it and contrast with another Schedule II substance. A very famous Schedule II substance is Oxycontin. Lately there have been a lot of news about Oxycontin being abused by people who were legitimately prescribed Oxycontin for pain. So let's compare how addictive Oxycontin and Adderall are to each other, considering that they share the same class, the same Schedule II class as designed by FDA. Well, anyone who takes Oxycontin for a long enough time in prescribed clinical doses will eventually have to be carefully tapered off Oxycontin. And a person who's taking Oxycontin for a long time is very likely to suffer from physical withdrawals. If a person forgets to take their Oxycontin for a day, they're very likely to feel those withdrawals come certainly by the end of the day, if not by the beginning of the day where they forgot to take their dose. Many patients who are prescribed Oxycontin for pain are then tempted to self-increase the dose, and that escalation of dose have to be monitored very carefully by pain management, and a lot of times have dangerous, if not fatal, consequences. Looking at Adderall being taken as prescribed, a lot of times people who are prescribed Adderall in a clinical dose and continue taking it in clinical dose, which is under 60 milligrams a day for adults, do not have to be tapered or taken off it when they want to stop. Sometimes people take it 6 days a week or 5 days a week and don't take Adderall on weekends because they don't feel they need it on days when they don't work or go to school. Sometimes people run out of Adderall and don't need to manage their withdrawals by anything else than a couple of extra cups of coffee in the morning because they feel drowsy. Generally, Adderall withdrawals, when people stop Adderall after they've been taking clinical doses as prescribed by their physician, do not have any withdrawal symptoms that need to be medically treated or are treated as a medical emergency. The only way that people really get severe addiction to medications like Adderall was when they're not being prescribed it, but are rather buying it on black market, when they are voluntarily exceeding the dose, or when they're using other methods of taking Adderall, like either sniffing it or injecting it, or using some other means. Typically, for whatever people are taking their Adderall for, let's say to increase attention, concentration, and time management, if people are taking it for the right reasons, then usually the same dose continues to be effective, and escalation of dose by the patient is not really a clinical concern. So even though Oxycontin and Adderall share the same Schedule II, same controlled class by FDA, you really have to take this information very carefully. Adderall is Schedule II, meaning very, very controlled, but it's not nearly as physiologically and physically addictive as Oxycontin, and is not as likely to be abused by people to whom it is prescribed by a physician in clinical doses for a good reason. Come and talk to me about your psychotropic medications, including stimulants and Adderall. I'm Dr. Fruitman. This is Trifecta Health.